This is NDDC Today.
Good evening. As much as we try, we can't get out of this COVID-19 superstar that's sweeping the world. I mean, you try to see what you can do to actually get out of the mood this pandemic is creating all over the world, and it's difficult to do so. So in the Niger Delta, the NDDC has come up with its own way of coping with the spirit of the people, as well as some physical help to see how we can manage this pandemic in the Niger Delta of 20 million people. Welcome to NDDC Today.
The world and Nigeria reel under the devastating effects of coronavirus, now christened COVID-19. The NDDC rises to protect its 20 million people. These people, already devastated by epidemics of lack of basic amenities and infrastructure, soil and air pollution, poverty, cannot afford another one. The spread of this harbinger of death.
When people come down with COVID-19 infection that requires hospitalization, the mainstay of treatment includes the ability to make sure that the patient is able to breathe properly, and this will be done using ventilators.
Mustering a resource of over 1.4 billion naira, the NDDC budgets 775 million naira to help the Niger Delta to provide ventilators, oxygen apparatus, drugs across the 9 states of the Niger Delta. 270 million naira to fast-track isolation centers in 27 senatorial districts across the region. This epidemic that has so far killed over 92,000 people worldwide must not be allowed a foothold in the Niger Delta. Meanwhile, Niger Deltans are strongly urged to cooperate with all the guidelines of the NDDC. Self-isolation, social distancing, hand cleanliness, protection of face areas, management of sneezes and coughs, and adherence to lockdowns. The NDDC backs the NCDC to stop COVID-19 in its tracks in the Niger Delta. Will you join us? The NDDC, determined to make a difference.
So this tiny little virus called corona is intimidating the 8 billion people that live on planet Earth. 2 million confirmed cases, 167,000 deaths so far. Now back home in Nigeria, we have over 782 coronavirus cases with 197 recovered. And that's not a very bad percentage when it comes to it. After all, they say the fatality rate of coronavirus is 2%, which means that many people who initially contact the disease actually can recover and can be treated. In the Niger Delta, the NDDC, being an intervention agency, not only in terms of infrastructure, but also in terms of health. You may know that now the NDDC is revamping the free healthcare program that, once went across all the states in the Niger Delta, providing free healthcare. Healthcare is a primary concern of the NDDC. The acting MD is a virologist, so this is in his turf. And we thought we'd take him up on coronavirus and how the NDDC hopes to cope with the rest of the 9 Niger Delta states to curb the epidemic. Welcome to the interview. What is COVID-19 and what kind of people are likely to die from it?
There are many strains of coronavirus. And because the coronavirus is a family of viruses, they're called the coronavirus because they have those spikes. And corona is like crown. It's like a crown. That's why the name came coronaviruses. And they use those spikes to enter into the cells they infect. So coronaviruses cause a wide range of illnesses, part of the common cold, part of different types of illnesses that most of us have been exposed to and did not even know we were sick. The virus actually destroys the lungs, so people with chronic pulmonary problems, asthma and so on are more liable or more at risk of progressing badly in this illness. The thing about most viral infections is that in the space of time, the body's immunity is able to overcome. So with somebody whose immunity is not compromised, the infection, the person will be sick for quite some time but will overcome this. But where the immunity is sort of compromised, or somebody has an underlying illness, hypertension, diabetes, renal, you find that most of the people who have died are people who have one form of underlying illness. The virus actually destroys the lungs, so people with chronic pulmonary problems, asthma and so on are more liable or more at risk of progressing badly in this illness.
Well, we've heard talk about the U.S. complaining that black people in Africa don't seem to be as affected as people from other parts of the world. And they're beginning to think that there's something about the black race that's keeping this pandemic from them. Prof, would you assent to this, or do you have a contrary opinion?
There are people who do not believe that the virus exists, first of all, and they say it doesn't kill black people. But if you go to the United States, in Chicago, even though the blacks constitute a lesser percentage, more of the deaths have been in black people. About 33% of the deaths are in the black population, who are less in there. So it has no ethnic coloration. It doesn't kill Africans. The population dying in Africa now is increasing gradually. That's the same way it started in the US, the same way it started in other countries. So we have to be very careful. It is not yet over.
Prof, let's come to the naughty one. I mean, when things like this happen, like pandemics, people propose all kinds of conspiracy theories. The one flying about now is that coronavirus is actually a byproduct of the new technology called 5G. Is this true?
From my little understanding, the 5G is supposed to be like a massive improvement on the 4G network in terms of speed of delivery, in which you'll be able to even download 1 gigabyte in 1 minute. Means a faster communication network. And I think there is no scientific evidence to link the COVID-19 pandemic and the 5G network. From the scientific point of view, or the molecular biology point of view, this novel coronavirus is called the severe acute respiratory syndrome virus 2. It's like similar to the previous one, SARS, but from analysis of the genome of the virus is showing that this could be, it's not been decided yet, could be from a recombination of two different viruses that existed in two particular groups of animals. The pangolin, which is the scaly anteater, which is very common in China, I think in Africa too, and a particular species of bats. So some viruses like the coronavirus, HIV, and quite a number have what is called recombination, in which two viruses will combine to form a more effective, more virulent strain, which causes a problem from time to time. Even the swine flu and all those were also from reshufflement and some form of recombination. So from evidence, there is still a lot that is still not known about this virus, but it's clear that it's not from genetic manipulation, and it is not from one lab, even though there are all those conspiracy theories. But what is available on the public domain is that it is a recombination.
MD, we know that, basically everybody complains about the lack of proper medical facilities, both pre and after many things. Now, do we actually have enough kit to make the testing for COVID-19 effective in Nigeria?
Testing is very key, but testing is also a problem. I don't think any nation has the capacity to test everybody in terms of reagents and the type of tests. We're very aware of test kits. I think I've spoken about this before. Quite a number of nations have also made the mistake of acquiring test kits that ended up being useless. Right now in Nigeria, the NDDC is doing a very good work, expanding the testing centers and getting requisite equipment. The way forward for Nigeria is to increase these testing areas.
We seem now to be so familiar with SARS, before this COVID-19. So people are saying, well, they're all basically the same viruses, but operating in different ways. First, do you think this is true? And can the kits used for SARS testing be used for coronavirus?
There is a similarity between this COVID-19 strain and the SARS, but there are also a lot of places that are very, very different. And that's why most of these test kits will not work, because it will end up detecting previous SARS or ordinary coronavirus infections, because those tests look for antibodies instead of the antigen or for the virus itself. Those test kits do not have the capability to detect the virus.
What is the NDDC doing precisely to help the 9 state governments to combat COVID-19?
Having discussed with the different states, we didn't want to also duplicate efforts, which will end up wasting, so we work in synergy. But really, let me give an example. We wanted to get ventilators. Ventilators used to cost about 8-9 million naira. In 1 week, ventilators have gone to almost 30 million naira for one. And most of the people who tell you they have ventilators for sale do not have them in the country. Ventilators are in short supply even in the United States. The ones we got in contact with found out that really their delivery dates will be end of April and sometime in May. So why are we tying up money when we could give to the states? With the lockdown and with let me say some logistic problems and profiteering that was taking place, the NDDC decided instead to support the states in the NDDC region with financial support, which has been passed on to the 9 states to increase their capacity to contain the COVID-19 pandemic. It is not our place to tell them how to go about that. Every state knows what their difficulties are. They know what facilities they have and which ones they require.
The world and Nigeria reel under the devastating effects of coronavirus, now christened COVID-19. The NDDC rises to protect its 20 million people. These people, already devastated by epidemics of lack of basic amenities and infrastructure, soil and air pollution, poverty, cannot afford another one. The spread of this harbinger of death.
When people come down with COVID-19 infection that requires hospitalization, the mainstay of treatment includes the ability to make sure that the patient is able to breathe properly, and this will be done using ventilators.
Mustering a resource of over 1.4 billion naira, the NDDC budgets 775 million naira to help the Niger Delta to provide ventilators, oxygen apparatus, drugs across the 9 states of the Niger Delta. 270 million naira to fast-track isolation centers in 27 senatorial districts across the region. This epidemic that has so far killed over 92,000 people worldwide must not be allowed a foothold in the Niger Delta. Meanwhile, Niger Deltans are strongly urged to cooperate with all the guidelines of the NDDC: self-isolation, social distancing, hand cleanliness, protection of face areas, management of sneezes and coughs, and adherence to lockdowns. The NDDC backs the NCDC to stop COVID-19 in its tracks in the Niger Delta. Will you join us? The NDDC, determined to make a difference.
MD, everything about the Niger Delta sometimes is controversial, and people are saying, what's the NDDC got to do with COVID-19? How are they getting involved? They have more serious things to do. Can you tell us the extent of your involvement with the states and provisions in the NDDC Act that justify your intervention?
The Niger Delta Development Commission was established as an intervention commission to cater for, it has mandates that's to cater for development, but also to look after the people in the region. And if a lot of the problems that the commission has had over the period of time is like working without synergy with the different state governmts. I can give example of primary care centers that NDDC has built over the years in different states and given to them, and that are not functional because the state governments were not carried along. So I think it's very wrong for people to say that NDDC should not support the states that fall under the NDDC region. So who should NDDC support? NDDC cannot even go straight. Like even if we had bought all the equipment, we still need to go and hand them over to the state governments. Do we go to the streets to give people ventilators? Do we go to the street to give people drugs? No. It is the state governments, and I think we've done the proper thing.
Well, Prof, you're a member of the NHIS in Bayelsa State, so you should be quite aware of all the situations that happen with this nationwide. What is your take on the scheme for every Nigerian, and particularly for Niger Deltans?
Health insurance is the key to universal health coverage, which is the desire of everybody. But health insurance cannot be voluntary. In all the places where this has worked, it is mandatory. The UK that has the NHS, as far as you work, you contribute to health insurance. And in Nigeria, it's been very difficult. We have the NHIS that in about how many years of its existence has been able to cover only 5% of the population. Now, the different states have health insurance schemes. I am on the board of the Bayelsa Health Insurance Scheme, and I know how it took us to, just because it was made compulsory. And there was a lot of opposition from the civil servants that why are you collecting 2% of their salaries? But by the time the benefits came, I think quite a number have seen the benefits. But what about the majority of the population in the rural areas? The problem is, how do we capture these people? There are no databases. Most people are living in houses without street numbers, without street names. How do you get these people to key into and pay for this? It's a problem that needs to be addressed seriously. Health insurance is very key. And even the United States, where it is not compulsory, they have a lot of problem with health insurance, and it's affecting this coronavirus deaths in the US. So we just pray that there's no explosion here, because up till now we pay for health. We are still operating a capitalistic system. In Singapore, that has one of the best insurance schemes, and the Scandinavian countries, it's compulsory. You pay, and there are different gradations. What Well, basically what we're doing in the Bayelsa Health Insurance Scheme is social insurance, in which those who earn more subsidize those who earn a little. And I think Delta State has one that's working very well, and Lagos State also. But I think it is something that should be made compulsory for all Nigerians, so that health is available to everybody.
The acting MD, NDDC, Professor Kemebradikumo Daniel Ponde, himself a virologist, expressing his mind and giving us information about the coronavirus and how the NDDC hopes to help the 9 Niger Delta states to cope, to safeguard the 20 million people that inhabit the Niger Delta area. Now, as we said earlier on, all the talk is about coronavirus, COVID-19. But people still have to eat. And we'd like to go back now on the agricultural policy of the new MD, who says that the Niger Delta has deviated from its mainstay, which is agriculture, and that whatever comes in through oil should actually be plowed into how agriculture can be revamped. Here's the story.
From all indications, the new management is determined to leave some form of a footprint on the agricultural development of the Niger Delta. This much was revealed by the acting MD, Professor Kemebradikumo Daniel Ponde, who said his administration would put measures in place to encourage youth to go into agriculture.
I want to assure you that we want to engage the youths, and not only the youths, everybody in the region into the programs that will be coming our way. There is the IFAD initiative, bringing a lot of money for agricultural initiatives, and I'm very, very sure all of you will want to key into it. Yes. And I said earlier, there's also money from Central Bank for agriculture.
The NDDC over the years has tried to revamp interest in agriculture, the mainstay of the area's economy before oil. Many of these attempts have had little effect, however, in the Niger Delta. The Niger Delta covers an estimated land arable area of 20,000 square kilometers within a wetland area of 70,000 square kilometers, formed primarily by sediment deposits. The Niger Delta is home to 20 million people of 40 different ethnic groups, making up 7.5% of Nigeria's total landmass, the largest wetland in Africa and the third largest in the world. Save for the devastation of oil exploration and exploitation activity, the Niger Delta is well primed for agriculture. The area has a potential demand for basic food items of 87,000 metric tons. Currently, only about 46,000 metric tons is met. That leaves a huge deficit of 41,000 metric tons of food, which means that the Niger Delta, that could easily be self-sufficient in food, still imports a significant amount of food. This has been largely due to persistent neglect of this sector as a result of inconsistent policies in the past. This has put some stress on the economy. Presently, if things continue as they are, the Niger Delta as an entity risks food shortages, which, if not checked, could lead to more economic tension, significant threat to social harmony. With the new thinking on the part of the new management, the parameters for a new consciousness for the revamping of agriculture and its various enterprises could easily be laid.
The NDDC repositioning to perform better. The change agents are in place. The task has begun, reassessing priorities.
The Niger Delta region can develop at a different pace from the rest of Nigeria. We don't need to develop at the same rate.
We must do what is right. Whatever has been done wrong, we must correct it from here.
The president insists that every penny spent on any project in the Niger Delta must be well accounted for.
Identifying no-go areas.
Every program that's been on, I think, should be encouraged, whilst we tone down on all the programs that have been abused and has given the NDDC a bad name, especially emergency projects which were abused in a very, very bad way.
Setting the standards.
The Commission must prioritize some signature projects in each state of the 9 states of the Niger Delta.
Not only projects, we also have to empower our people. Agriculture, if you check today in Niger Delta, we have left agriculture behind.
The support is coming from everywhere.
We hope that we will, in the best interest of the people of the Niger Delta, continue to work collaboratively with the membership of the board of the NDDC in the best interest of all.
Let it be that at the end of whatever period we spend here, that we will be able to say that there's been a change in the Niger Delta.
The NDDC, repositioning to perform better.
So the deaths of COVID-19 is being planned meticulously by the NDDC and the 9 Niger Delta states. And don't forget, listen to all the advice you get as to be safe from this virus, social distancing, hand washing, and all the advice you've been receiving. But I will tell you, don't forget, your simple solution sometimes, warm water in lemon. We'll see you next week. Thanks for watching.